because we are sisters in this work to see our women in our communities healthy and whole. That's what we're able to do. The making of a champion. I think what's important to look at, and I've already talked about this, this is talking a little bit about my background, but what I'm recognizing since we're here at mentoring the next generation of leaders and scholars, that we have to look at women who are mothers and who are students. We need to start right there because they have responsibility for someone else. They are, if they're a young mom, they're responsible for their child and fill in the blanks. But if they're a student leader, and they are running the show and they're coordinating activities and they're, interfacing with administration. They have all the makings of being into the arena. Because you know why? When we're hiring, who here hires people? We're looking for that. So tell me, what do you do? Tell me, we don't care how you get the experience. We want to know, can you lead a project team? Do you work by yourself? Are you responsible? Can you meet deadlines? Do you understand how to get to use technology? And so we're looking for young adults to give us that kind of information. And in today's market, that's the people that we have to hire because we don't have to pay benefits. They're able to use their skill and they're able to get an outcome behind it. It's a very smart and strategic move to make. But there are young leaders. So we no longer look at the women over there. The phenomenon of the 21st century is that we have today 4 generations in the workplace. And very soon there'll be the 5th one. So anyone who has a teenager who's in high school, they're that 5th generation. And we'll still be working. So we have a huge opportunity to make champions around this work. I'm just going to, I really didn't mean to put this on all the animation, but as a result of doing this, we wanted to, I'm just going to fast forward through here. It's just telling our mission and vision statement. Okay. To look at the generations that are involved, we've had to strategically recognize that we have to bring a message that we're building our community. So how do we personalize it? Building my community with greater compassion. And looking at that we want to dedicate our time to mentoring and nurturing the next generation of leaders, because guess what? In 15 years, I don't want to be working doing this at 70. Now I may be working and writing books and things of that nature, but I don't want to be working at the rate that I'm working today. But the people who are 35 and 25, we have to give them the opportunity to move forward and to give them really exciting projects to work on and to shadow us and to move side by side. Because you know what? Women are having babies every day. This hospital has 3,500 deliveries every year. That's just one hospital. So babies aren't going away. So we have a huge profession to really engraft them in. And you know what? They want to do it because our virtual administrative coordinator, Meredith, she's at Cal State Bakersfield. She came to see me during her spring break, and I said, oh, you got it. She's pre-med. She wants the OB side. She's gone forward. And that's so exciting because we've given her something. So this is the last piece I want to give you here because this is what I wanted to tell you to wrap up. The company that we keep. This is probably the most astounding way of showing the data around infant mortality because let me show you this. We're looking at internationally, but you want to see that LA County has worse birth outcomes, infant mortality than France, and California has worse than Portugal. Okay, but then let's look at, when you see African American, the city of Long Beach is worse than Chile. African American. So let's go to the other side. Here, we're replicating our work in Nebraska. So Nebraska, which there's a slide behind there, Nebraska is a huge state. Omaha, a county in Omaha with the African-American infant mortality rate, that's looking like LA County. Omaha, Nebraska. And then down here, which I think is really interesting, when you look at San Bernardino has worse birth outcomes than the countries that have been at war, Russia, Panama, Romania, Bulgaria, Sri Lanka. That is crazy. But that's the African American infant mortality rate compared worldwide. And this information, and for those who like the geek in us, who likes to play with the numbers, you can just go right here and make this comparison. It is just really important to drive home to you that if we do not arrest the infant mortality rate, this is what we look like. I am out of time, but it was my questions. It's my look. Can I show you this slide on Omaha? Because I think that's the thing that really is, because you get to. Okay, here's the Healthy People 2010. This is the animation. That's good, but okay. So if you look down here, I think this is just so exciting. This is the state of Nebraska. I've never been to Nebraska, but I get to go. And Omaha is right here. Douglas County, Omaha is right here. So that's what it looks like. So the black community is centered right in here. And when I look closely at this data, Omaha, Nebraska, Douglas County looks like Pasadena, 1992. The Pasadena Birthing Project is a response of the Northwest Commission to say that Northwest Pasadena, so think of Northwest Pasadena, Douglas County, that it's a condensed population of African Americans. You've got a mixture of people from a social economic background, but there were no services to support African American women, or limited. So there's 4 different hospitals, and these are the number of practitioners that they have to the side. So they have 1 OBGYN, 1 family practitioner. You know, they have part-time nurses. That was Pasadena, 1992. I'm going to open up for questions. You know what? I can't give you the numbers, but I put on your table an article that came from the Seattle Times. And they focused in on, so really the story was around New Jersey. But it's just really amazing when we look at the infant deaths in your traditional urban communities. They're high. They're like 21 or 15 deaths per life. Yeah, 1,000 births or over. And there's also a high incidence of maternal mortality in New York and New Jersey and Chicago.
Could you talk some about what can be done to support couples as well? Because there's a lot of research that drop couple satisfaction, a lot of couple conflict after the birth of the child. And that flips around. More couple conflict, the less fathers are involved, and the less well children do. What can be done in this context to support the couple relationship, and do you have any thoughts about that?
Yes, we have demonstrated outcomes about that. So I'll give you the Reader's Digest version of it. I think it's important that all of us are interested in the data, but men are really interested in hearing the data. That's what draws them in. It's bottom line. It's what can I do to help that. So we're able to really find out from men what's going on in their family. When we draw them a little closer. Men respond to men. So in the African American community, even though we had a very successful Healthy Fathers, Healthy Men, we hired an African American psychologist who looked like the men in the community to run the show. And even though we were there, remember the Mother Read program I talked about? So we had, you know, that was Mother's Night Off. So they had to bring their babies. And we had sister friends to come out and to play with the children. But the fathers talked, and the father's perspective is very different from the mother's perspective. And so we were able to really document how they felt about this particular pregnancy, or maybe this particular relationship that they're in. Because, you know, generally women don't walk away from their children, but men do. And so that means we marry men or have children with men who walked away from other relationships. And that causes angst in the home. That's just one thing. But let me just finish with this. So there's opportunities to bring men involved. The mother read model, mother read, father read, again, men love the opportunity to play with their children. So we created My Daddy Reads to Me. So again, these are opportunities to just get men involved. But I think that a lot of times when there are communication issues going on in the home, outsiders know that. And so what we're able to do is set up opportunities to engage the family together. And we were able to, with having Dr. Connor and others available working with us, we worked very closely with Fuller at the time when we had that program. So we had referral opportunities. And some couples actually went to couples counseling because they saw that they can come together for a program, and how can they come together for the next part. So we facilitate relationships as opposed to really coming in and providing that intervention, because that's not our charge. But I think it's very important that we bring fathers into the conversation because they relate to the information differently, and sometimes it's really about trust. Because we, again, as African American women specifically, I'm talking about, we have secrets. We have family secrets about our health. We have family secrets about the way we were before, if we had humble beginnings, and now this is what we're like today, but it plays out in our birth outcomes. And so we have to address that. Yes, Dr. Doxson.
So my question is about postpartum depression. You know, there was a study done, the LA Mother Baby Survey, a couple of years ago, and it showed rates of some sort of depressive symptoms to be sky high in African American women, like 45 pushing 50%. Not like maybe clinical depression per se, but some level of depression. So my question is this: in the women that you're working with, the sister friends you're working with, is that recognized? And if it is recognized, how is it understood? I mean, postpartum depression is such a clinical term. You know, like I would imagine, because this is what I see at USC, that it's understood as stress. You know, it's understood as being overwhelmed. So I guess that's a two-part question: is it recognized, and if so, how? Does he understand?
It's not recognized from our perspective. But when I look at my trained clinicians who work closely with us, together as a partnership, we have to start looking and putting the dots together. So my CBO collaborator and I were not clinicians, but we talked about the mother who had 14-year-old who has a hearing aid, but she had a healthy pregnancy, but he was born 2 months early. That, you know, you have to come together. How can we facilitate? How can we help this mom? So a lot of times it's a case-by-case basis is what I'm finding. And there is really no answer to it because many African American women do not go to therapy.
Sure. Much less psychiatrists.
So they're not going.
Right.
But what we do, and I just have to tell them, we trick folks. You know, we trick folks. So the Healthy Fathers, Healthy Men was facilitated by a clinical psychologist. So he knows how to work the room, keep the balance together. If someone's issue became a little bit more pronounced and just overwhelmed the conversation, he knew how to separate that out and keep everybody in balance. So that's why I say we trick people, you know. So we want someone who's going to give the community dignity and respect and be able to come in and hear people's stories. And for me, it doesn't really matter the ethnic background of the clinician, but it's knowing how to have respect for our community and for the nuances of our community. Because again, it's really riddled in, I shouldn't say riddled, it's seeped in secrets. So when people start feeling comfortable telling you their secrets, and our secrets have a lot to do with racism. And that racism leads to stress, and then what we do, we may be ferocious, if you would, on the outside, and we go home and we're depressed. We're not talking, we're not eating, we're sleeping, we check out. So we live dual lives. I don't really have an answer on how to really pull that together, but partnerships with community-based organizations are really important because we see the people all the time. And we see them in a non-threatening way because we're not checking off, you know, who we're, you know, if you don't do this, we're going to report you. We're not in that kind of situation. So I think there's really opportunities and there's room for us to collaborate and to talk as professionals and to say, here are some case studies we can put together to just find out, because there isn't really one answer. There really isn't one method to doing this. But I think that the partnership that we have, and your question is a very valid question because we do not go to therapy and we are taught to handle it.
Right.
Your grandmother handled it. Your mother handled it. You watched, so no one tells you that's what you do. So when you want help, we look at that as being weak. I can't handle it.
Thank you.
Is that it? Oh my gosh.